Okay. So the topic for today is how to set up a level 1 ART clinic. But before doing that, we have to understand, please next slide, please. We have to understand that what do we mean by the level 1. Next slide. So the latest ART Act has categorized ART clinics into two categories, level 1 and level 2. Level 1 are where only IUI can be carried out as a part of treatment, and level 2 ART where the gametes are handled outside the body like IVF, where the in vitro fertilization is happening. That is level 2. Thankfully, ICMR guidelines had actually 3 levels, level 1, level 2, level 3. They have actually removed the first level. That is a good step on the part of the government, that somebody who is just writing oral ovulation induction drug or doing a laparoscopy or writing a semen analysis test can very well go ahead and do that. So a routine gynecologist does not need a ART level 1 registration. They can all do ovulation induction, they can do a follicular study, they can do semen analysis, they can do laparoscopy. Only if you are doing IUI, then only you need to register for ART level 1. So this is one thing which I think government has done good than the previous ICMR guidelines. Next slide, Bharti ji. Yeah, so this is just a little historical outlook of the law that it came. 2005, we all know the bill came, then 2017 regulation bill had come, then 2020, finally a more final sort of bill came, and in 2021, December 2021, the law was passed in the parliament. Next slide. Yeah, that's the Gazette of India, in which this law finally was implemented after lots and lots of years of hard work. Next slide. Then in March 2022, next slide, and June 2022, its rules were published. Next slide. So now, as per the law, what the ART level can do. So ART level clinic can do OPD consultations, they can do follicular study, they can do semen preparation, including the donor semen. Even the donor IUIs can be done at the ART level 1, and they can perform IUIs. What the ART level 1 cannot do, that's very important, IVF, ICSI, embryo transfer, PGT, surrogacy, third-party reproduction, any ART bank-related work, ART level 1 cannot do. So till IUI, ART level 1 can do. Next slide. So next, please. So before we set up the clinic, we have to know whether we have whether we have the required personnel. This is number 1. Do we have the required personnel for the ART clinic? And then do we have the required infrastructure? And then are the equipments too expensive, or can we actually afford the equipment? These are the 3 things which every gynecologist will think first before starting the ART level 1. And then once they have made sure that yes, they have the required personnel, they have the infrastructure, they have the equipment, so they can afford the equipment, then comes the process. So coming to the personnel first. Next slide. So this is very good. Only one gynecologist is what is written in the law. So if you are a gynecologist, you do not need anyone else. You don't need a counselor. You don't need an embryologist. You don't need a director or no one else. Only one gynecologist is sufficient to register for an ART level 1 clinic. And the gynecologist has to be a medical postgraduate in gynae and obstetrics. Additional experience should include, of course, understanding of the causes of infertility, and all the needed things for the infertility practice, which anyways, as a part of the MD curriculum, all the gynecologists are undergoing. Next slide. Next slide. And the responsibilities of the gynecologist has been defined in the law. It means interviewing the couple, history taking, physical examination, recommending appropriate tests, treating medical disorders, carrying out gynecological endoscopy, ultrasound interventions, carrying out IUI procedures, self-appraisal, and maintain records for audit. That is very important responsibility. Next slide. Next slide. Yeah, that becomes the problem when somebody else is. Malti, next slide. Yeah. So now coming to the layout or the infrastructure that we need for the level 1. Piche wali slide pe chale jayega. Back, please. Back slide, please. So in the infrastructure, do we have the required infrastructure? What these are the infrastructure requirement. General requirements are that you have to have a reception area, you have to have a nice waiting room, consulting room, you have to have a storage space, a records space, examination room with privacy, backup power supply, and fire safety arrangements. In the laboratory services, you must be having a general purpose clinical laboratory. The laboratory can be in-house also, can be a referral also. You can, you can just send the blood test, but you should need to have an MOU with some path labs. Requirement for the clean area, you need to have an IUI room, and you need to have a semen collection room. And in the sterile area, you need to have an autoclave area and a semen processing laboratory. So these are the basic infrastructure written in the Act. Next slide. So semen collection room has to be a separate collection room. It cannot be just a simple washroom. It has to be a well-appointed room with appropriate environment, located in a secluded area, close to laboratory, and it has to be in-house. The room must also have a toilet, and toilet cannot be used for any other purpose. Next slide. So now comes how to register for the level 1. I think we have missed the slide somewhere here. The equipment slide was also there. Can you please go back to the slides? Go back. Okay. So somewhere it is on the slide. So is it on the slide slow? Yeah. So anyways, the equipments I think somewhere are missed here, but there are only 3 equipments which are law, and the equipments are: number 1 is centrifuge, number 2 is fridge, and number 3 is microscope. So you do not need fancy incubators, or even the macular sperm counting chamber is not written in the law. With just 3 simple equipments, which is fridge, centrifuge, and microscope, you can register for the ART level 1. And now comes the process. How do you register? So you have decided, you know, you have the required person, which is just one gynecologist. You have the required infrastructure, and you know the equipments are not very expensive. How to register? Next slide. For that, you have to go on this portal, which is National ART and Surrogacy Registry, and on that we have to register. Please, next slide. This is the form which will come up, and you have to fill up that form for ART level 1. Next slide. And then the filled out form PDF printout you have to submit in the appropriate authority, and they will come for your inspection. And then if they decide to give you the registration is valid for 5 years. Next slide. And this is how a certificate of registration looks like. Lots of people have actually already got the registration. Many are still waiting. Next slide. Now comes the fee structure. Can we afford the fee structure? Next slide. So for level 1 ART clinic, it is rupees 50,000. That is the registration fee. For the level 2, it is 2 lakh. For ART bank, it is rupees 50,000. And for surrogacy clinic, it is rupees 2 lakh. And it is free for the government organization. So earlier it was like around 2 lakh. And then somehow, thankfully, they decided to bring down the amount to 50,000 for level 1 ART clinic, which is pretty affordable. Next slide. What other registration you would be needing to run an ART clinic? One is PC-PNDT registration. But one surprising thing here in the Act is that they have not mentioned ultrasound machine as mandatory for running an ART level 1. So if you do not have an ultrasound machine, would you be requiring PC-PNDT registration? That is something question mark. So somehow anyone who is registering have all got ultrasound machine. But once if that day comes where somebody is getting the ultrasound done from an ultrasoundologist, then whether they would be needing to register at PC-PNDT will be question mark and will have to be asked from the authorities. The second registration, of course, ART level 1, you will be needing MTP Act registration also they're asking. If you are not doing MTP, then they are asking for an MOU with some hospital where MTP could be done. And as with the PC-PNDT Act, you have to maintain one copy of the Act at the clinic, at every clinic or bank, and certificate of registration has to be displayed at the clinic or the bank at a conspicuous place. And such certificate shall contain the duration of the validity of such registration, which is 5 years. Next slide. Now comes the duties of the ART clinic. Once you have registered, what are the duties? Next slide. Next slide, please. Yeah. So we have to ensure, once we have registered, to ensure the eligibility to avail the ART procedure. So that's very important to know the law. So there are age limits. We know ART we cannot give to less than 21-year-old women or more than 50-year-old women, right? So we have to be aware of the age brackets and ensure that the couple whomsoever we are treating are eligible. So many times it comes, a 19-year-old lady comes, you will not go ahead and do IUI because she is not under the purview of law. Or a 51-year-old lady comes to an IVF center, they will not go ahead with treating them. Obtaining donor gametes from registered AR banks, ART banks. So if you're doing donor sperm IUI, you have to ensure that you are getting the donor sperm from a registered bank only. And then you have to provide professional counseling and support and ensure confidentiality of the involved parties. Next slide. Consent forms are all there in the law, and we have to make sure that we get these consent forms filled. Form 7 is for consent when you're doing a homologous IUI or IUI from husband semen. Form 8 is for IUI with donor semen. So we have to make sure that we are filling up all the right consent forms. Next slide. This is form 7. This is IUI if you're doing IUI from husband semen. Next slide. This is the sample of the form 8 if you're doing donor semen IUI. Next slide. Very, very important thing is you have to maintain a grievance cell. This is also a very important step that has been taken in the law, and a really appreciable step. You have to maintain a grievance cell, and the composition of this grievance cell you have to inform to the authorities. You have to have this form 5 at a conspicuous place in your clinic. So wherein if a patient has some grievance against the clinic, first of all they will have to apply in the grievance cell of the clinic itself, so that you will have full opportunity to settle down that patient, or to take care of that grievance. Next slide. So such kind of boxes, grievance boxes, suggestion box, are available on Amazon. You can order them easily from the Amazon. It should have some transparent window, and this should be installed in your clinic. And name and number along with the email of the grievance cell members, this should be displayed prominently along the complaint box, so that if the patient wants to directly mail to any member of the grievance cell, they can directly mail. And form 5 should be kept nearby, and the box is to be checked at regular intervals for any complaints and grievances. That's why they want it to be transparent here. So in my clinic, I had pasted the email numbers here. So they said no, it has to be transparent, so that if there is some form fallen into the box, you can easily see that. And you have to maintain a grievance cell register and sign it regularly to ensure that the grievance cell has been checked. Next slide. And record keeping is very important, and 10 years is the time limit that they have given. That records are to be maintained for at least 10 years, and except under special circumstances where it can be transferred to the central database. So suppose the clinic closes, then the records are to be transferred to the central database. So you have to make an IUI register with all the details of the case, along with the name, address, numbers, plus preserve all the consent forms for 10 years at least. Next slide. Yeah, so this is just the clause that I have mentioned here, that there is no confusion. The records are for 10 years. Next slide. And by every 5th, we have to send all the records to the authorities. And these authorities have the right to search and seizure of your records. They can come anytime without any notice, and they have full rights for the inspection of the clinic. Next slide. So main feature of the act is that every clinic and bank has to be registered, and consent forms are very important conditions for especially donor sperm IUI. You have to understand. And gamete supply, if you're taking donor sperm, has to be taken from a registered ART bank. That you have to remember. Next slide. Yeah, so I think more or less I have covered, and the punishments are pretty harsh, and so we have to be very careful. Thank you. Next slide. Yeah, ignorance of the law is no excuse. So it is really important to read the law verbatim and then go ahead. Thank you.